Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, the President of Regulatory Solutions at Penstock, and today's topic we'll be discussing our favorite, routine adult dental. So we all know that pediatric dental has been historically covered to date with any ACA marketplace plan on or off the exchange. The question that CMS is posing for 2025 is whether to require routine adult dental as an essential health benefit. As of recently, CMS has allowed the option for states to choose to include routine adult dental as now part of their EHB benchmark plans. That being said, on paper, it's a great thing, offering new benefits for plans to diversify their portfolios and perhaps even gain a competitive advantage by offering dental where other carriers do not. But what comes with that is a lot of implications to how plans are designed and prepared, and a huge impact to a plan presence and strategy in the marketplace. Routine adult dental is not cheap to implement. It is highly expensive and has a cost burden to a lot of plans, especially smaller regional health plans. As of recently, since CMS has approved this policy change, allowing states to make their own decision to cover adult dental as an EHB. This could be really interesting for the next few years as EHB benchmark plans are updated by state divisions of insurance. Now, some states have made it a little bit easier for other carriers by stating if there is a dental carrier or standalone dental plan offered on or off a federal exchange, that a carrier would always be precluded from having to offer routine adult dental anyways. Not all states are the same. What this means is if you have a strategy or a roadmap to expand your market presence, please take a close look at how your regulators have established their guidelines. Even give them a call. Ask them if it's in their crosshairs or the line of sight to require routine adult dental going forward if that's not part of your core breadth of strategy. While any addition of benefits for essential health is great for the member and favorable for the members that we serve, it's really important to understand that this would impact any carrier's cost position, price position, brand recognition, and other attributes to the health plan in a marketplace. Whether you're looking to gain net new membership or even retain or renew your existing membership, if other carriers are starting to offer routine adult dental and your carrier is not, regardless of state requirement or otherwise, you could see attrition with your membership to churn for members seeking dental care that need it more than they need their medical benefits. So we do see routine adult dental becoming more of a common theme, not just for 2025, but also 2026 and 2027. When EHB benchmark plans are updated towards 2027 and beyond, would not be surprised if further rigor is added around dental in general, both pediatric and adult. We can all agree that adding routine adult dental as an EHB for options for some states will improve healthcare for members with the hopes to reduce repeat visits to any provider and improve their overall longevity and health outcomes for years to come. It will be very interesting to see after 2025 as members do receive routine adult dental benefits and as it becomes more common within the marketplace to track how this impacts population health data. What we mean by that is the change in the member behavior, repeat visits back to the provider if they need more care, the cost of the overall visits for each dental visit, and evaluation of total cost of care for the actual member. Based on the data that's available to each carrier, which will vary in shapes and sizes, larger carriers may have more access to data than smaller carriers. We recommend you start developing a pipeline process for the known members that you know are receiving routine adult dental to develop all the necessary ROIs in place to understand the members that you're serving today. These will have significant pricing implications to how you set your premium rates for year over year. So if you are seeing that there's an influx of routine adult dental claims and expense to your total cost of care per member, it's probably a good point in time to look at how you're setting your premium rates for next year. Talk to your actuaries, set up a work group, and understand how do we bake in premium rates and pricing to overcome the expense of routine adult dental. It could impact the entire plan design or product shelf that you plan to offer in 2026, 27, or 28. Would not be surprised if this simple change for state decision making could impact an entire plan strategy year over year. For all the filers out there, I think it's important to call out how these routine adult dental and dental benefits would be filed. Traditionally speaking, as it becomes more required by states across the country, filers should include this benefit within your major medical portfolio, regardless of segment, if it's individual, small group, on or off the exchange. What we also know is that historically, standalone dental plans have been filed separately outside of major medical portfolios to satisfy member needs to give them their whole dental solution. What we may see going forward, and we'll track for 2026 and 2027 and beyond, is potential displacement of standalone dental plan filings. As we all know, SADPs come with their own set of CMS requirements and state-specific requirements, but we will be curious to learn which states are early adopters of this benefit and deployment for carriers within their state. Would encourage everybody out there, if you are an SADP issuer, to really think about the new federal rule and track carriers that are adding this to their major medical offerings. And if you are a health plan, to understand if there are SADP filings within the state that you participate in. If you do have a core SADP filing already available in your state, you either may be precluded from having to offer routine adult dental altogether, and if you do offer routine adult dental, it could be a challenge for your plan. So we talked a lot about the federal rule and CMS, the policy language. What we should really talk about now is how this benefit would actually be filed on or off a federal exchange, regardless of segment, individual, or small group. That being said, we already know that routine adult dental would be included in a major medical portfolio. So this would be inclusive in your traditional plan and benefit template and subsequent state-specific supporting documents. Every filer should know this right up front, and you should optimize your documents right now in anticipation for this for the states you're playing already. As states adopt this and deploy it throughout their states, and health issuers are required to offer it within their geographies that they're playing in, routine adult dental will be included in your traditional major medical individual or small group filing, regardless of segment. What does that mean for the filers and the people actually completing the work? Well, you should be mindful of how your plan and benefit templates and state-specific supporting documents are completed today with your current dental benefits. I'd recommend anybody in a state that you know routine adult dental will be enforced in 2025 and beyond to take a look at your current plan documents to understand how you've detailed and set up your dental benefits on your PBT and subsequent state-specific supporting documents. I know it may seem outlandish to do all of this work a year ahead of time, but it's really going to set you up in a good place to understand next year what changes need to be made if you're participating in one of those states. As we get closer to the end of the year, as we wind down with certifications and approval prior to AEP 11.1, it's really going to be important for your teams, probably the product strategy and operations team, to do a level of competitive analysis in the markets that you're serving to understand how routine adult dental will be enforced, if at all, for 2026, 27, and beyond. Going forward, we recommend evaluating any new market entrants, whether it's SADP or major medical only, entering states that you currently participate in, or if you plan on entering new markets bordering your states or across the country, to evaluate who currently offers this specific benefit already today. Why is it so important to do that? Based on your business plan or your strategy for expansion or annual renewal, routine adult dental, we can all agree, is expensive. We know it's in favor of the member, but please incorporate it into your overall strategy for competitive analytics, or else it could be detrimental to your roadmap as you proceed through 2026 and 2027. I think overall it's safe to say that we're seeing an ongoing and recurring theme from CMS with their policy guidelines and how they deploy new guidance and rules. Overall, the common theme is increasing access to healthcare and health equity for all the members across the country participating in an ACA or marketplace plan. Since we've seen routine adult dental introduced as an EHB and enforced by states today, we're now wondering what will CMS introduce tomorrow. Thanks everybody for tuning in today for another Regulatory Joe topic. Give us a like, give us a share. Would love to hear your feedback on what you want to see next. See you next time.